So I applied a superior force, and we found the sweet spot was with her hip in about 10 to 15 degrees of adduction. And sometimes that angle is less, sometimes it's actually into abduction. Just depends on their individual anatomy. And so the clinician needs to test that. But I just finished right now as the film started. That was 5 minutes. And so we'll now look and see if we created any change. So let's have you scoot up, please. So I'm taking the slack. I take the slack up, and it takes up quicker than before. Before it felt like it could keep going. Mm-hmm. And now I'm going to do a spring test, and it bounces right back. Mm-hmm. So a property of the structure, which is to have accessory motion, to be able to take up the slack, to be able to impart a little extra movement with the same amount of force and have a recoil, has been improved. Let's have you lie on your stomach. When I palpate the sacrotuberous ligament, I can now indent it. So it's not as hard as it was before, and positionally they look symmetrical now. So it's no longer closer to the ceiling on this side. I can now take up the slack, so you can see her head move when I do that. So we take up the slack, and now I spring it, and that force translates all the way up through her body, and I can see her head bobbing up and down. So now I'm going to come on the top of that iliac shelf, and now I can take up the slack inferiorly. You'll recall that that was stuck, and I can spring it, and I can see her feet move, and it bounces right back. So we've improved that property of passive movement, spring, recoil through the joint. And so this is a demonstration of an interesting case of downslip in which mobility was blocked in an inferior direction, and that's not a typical presentation. And I also showed how simple it is to treat a downslip, and it would take a large passive force to undo the treatment, okay? But I want her to feel comfortable in self-managing this, and she's going to just reinforce my treatment by doing a self-treatment once a day for a week, once a week for about 6 weeks. Okay? Let's keep filming, and we'll go into the living room and I'll demonstrate a self-treatment technique. Okay? So go ahead.